A chiropractor is not just a chiropractor. Hey, y'all, I'm Dr. Venn, your no BS chiropractor. What I mean by that is just because you go to one chiropractor, you're not going to get the same treatment when you go down the road to another chiropractor. There is a massive difference in everyone that you see. Now, there's a lot of different variations, but what I want to talk about is my experience with Gonstead and what does Gonstead do? If I read you from the Gonstead book, basically it would talk about all the precision, the mathematical equations to figure out exactly the detailed misalignment of the pelvis or the various bones, how we correct only the one bone that needs to be moved, and then you leave the healthy ones alone. And all that's true. But more than that, I guess what I want to get across is, as a practitioner and as a patient, what I see that is radically different. And so let's take all the science out of it. Let's just talk about, in general, what most experiences are going to be like going to a Gonstead chiropractor versus a traditional chiropractic patient. In most situations, a traditional chiropractic patient, when you go to get adjusted, you're probably going to hear and feel the same popping every time. And there's a lot of benefits to that. There's wonderful benefits to chiropractic. With Gonstead, in my office, what I experience is as patients do better, as they get better, they start to pop less. That's the beauty of it, because we're making a correction. So in the beginning stage, say we have a patient that comes in with severe low back pain, we check the whole spine and we make the adjustments necessary. And when we do that, day one, they were very hard to adjust. And so we got a little bit of movement, a little bit of popping. Day 2, 3, 4, 5, they start to move a little better, a little better, a little better. We get some deeper clunks, however you want to say it. They love it. And they're starting to feel better. But what's happening in the beginning stage is we take these stuck bones and we're returning them to more normal range of motion. So they're moving more and more and more. In the beginning, they will hit a point where they just move the best they can. Their range of motion is returned. Now, when we continue to work at that point, and we continue to adjust the same bones in the right direction. And as we do, then they begin to move less. Here's the critical part. They start to move less and less and less because they're being corrected. They need less and less and less. And so when I have a patient, we'll say fast forward maybe 2 to 3 months in, or if I just have a wellness patient that's just coming periodically, in general, they're not going to move near as much as they did on day one or at least in the first few weeks because they simply don't need the adjustment as much. And so as we go forward, we can measure how much that person needs me based on the amount the bones move when they come get adjusted. Now that sounds so simple, and it is, but that is not typical. That is not traditional chiropractic. That is not the way that it works. As a patient personally, before I met a Gonstead chiropractor, before I went to school, I would get adjusted many times, many times. And I felt the same popping every single time. It never changed, nor was it the goal to change. But when I started getting adjusted Gonstead, I noticed my bones moved less and less and less and less. And my feeling of needing an adjustment went away. And now, of course, I get checked, but I don't ever have the need to be adjusted as long as I get a regular adjustment by a Gonstead chiropractor. So I guess the main thing I want to stress is there is a purpose. There is a plan to a treatment plan. It should be based on function. It should be based on getting your spine to hold the adjustment better, to not need me as much, and getting to a point where eventually you will feel good all the time, and we're simply adjusting you just to keep you as healthy as we can keep you. I hope that helps. I hope that explains a little bit about why we do what we do, and a little bit more of the difference of what I do in my office and my expectations. My goals are to fix. My goals are not just to pop a lot of bones. My goals are not just to get as much movement as we possibly can. I know YouTube has made it where everybody likes to hear the pops. Well, a pop can be good if it's done in the right way on the right bone. A pop can be bad if it's done in the wrong way on the wrong bone. And that's not talked about enough. And so in my office, that is the goal, is precision care to give you exactly what you need. Leave the healthy stuff alone, and you will physically feel the difference in the movement as your bones, your joints, I should say, become stronger and stronger and healthier. If you have any questions or thoughts on this, please leave them in the comments below. I would love to answer any questions that you might have. You're welcome.